5. Entertain a motion to go into closed session to hear a confidential student matter and then student recess until now. So first we have our invocation that's being brought by Reverend Donnie Thurman of Palmer Grove Baptist Church.
Thanks for the opportunity. Let us bow our heads. God, we thank you for this pleasure of being in your house. And God, we say your house because wherever your spirit is, we thank you for your presence that sets the atmosphere. God, I want to thank you for these men and women who have such a great task before them. God, as they make decisions on behalf of our students, I pray that you give them the guidance and integrity and, God, the direction to be able to do everything in your will. God, again, thank you, Lord, for ordaining them for such a time as this. Continue to lead, guide, and direct. It's in the precious and mighty name of your Son, Jesus, that we offer this prayer. Let every heart say amen.
Amen. Thank you. Next, we have the Pledge of Allegiance. Mr. Hunt, you lead us.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Next, we have special recognition. We don't have that. Okay, all right. I'd like to recognize any guests that we may have. Do we have any principals or assistant principals? How about any North Carolina Association of Teacher Assistants? Any teachers or NCAE representatives? How about any elected officials? Do we have any parents as guests tonight? Okay, we got a few of those. All right. Glad everyone could be here and welcome. First item is adoption of the agenda. What's the pleasure of the board?
I move to adopt.
Motion by Mr. Humphries.
Second.
Second by Mr. Shores. Any questions or discussion on the agenda? Those in favor of the agenda, if you'd raise your hand. And that's unanimous. All right, next is public participation. And we do have 3 signed up. And just as a reminder, we've talked about this before, please be polite and respectful as folks are talking. We do have a 3-minute time limit. You'll see the timer on the screen. When it turns yellow, you've got 30 seconds left. When it's red, time's up. It takes about 1 page of notes you can get in about 3 minutes. If you got 4 or 5, you're not going to make it. So you might want to start working on that if you're not the first speaker. But we'll get started. First speaker is Wanda Porter.
Thank you. I feel that some teachers need to be put on notice about their attitudes and tactics for addressing the students in school. They're there to teach the students from what I'll call textbook teaching and stop their personal opinions. Students have been singled out and embarrassed in front of the fellow students for teachers calling them out for not wearing a mask. My granddaughter is terrified not to wear a mask to school. She says that she will be embarrassed and be called out by the teacher. She coughs in her mask, she sneezes in her mask because she's afraid to take it off. At the middle school in Kings Mountain, there was one child that the teacher asked her why she didn't have her mask on, and she was trying to explain to her why, and the teacher kept interrupting her and telling her, I'll get you a mask, I will get you a mask. She went to get the child a mask, she come back, the child tried to explain this again, the teacher told her to put the mask on. At the high school, one of the teachers in class told the students that if everyone would get their shots, that they wouldn't be in the situation they're in. That's none of their business. They're not there to teach that. We'll teach that at home. I do take COVID very seriously. My daughter and granddaughter have both had it. I have witnessed the effects that it has had on them. I am asking for the resignation of the person or persons on this board for their blatant lie by failing to disclose the full decision of this board regarding wearing masks. The automated call told the students, parents, and I assume teachers that masks would now be mandatory for all students and staff. They failed to tell them that they could opt out of wearing the mask by filling out a form online for reasons given on this form. Why did this person or persons make this decision on their own? Were all members in agreement on this? Did you decide to change things after the meeting, after the public was gone? It states in your rules right here that the members of the Cleveland County Board of Education are without authority to act independently as individuals in official matters. Somebody took it on their own as an individual to leave this information out, and to me that is a blatant lie. In closing, I just want to say be very careful what you say and do in future decisions, because you could be looking at the person who could potentially replace you at the next Board of Elections. Thank you.
Mr. Funderburk, if you'd raise your hand. Ms. Porter, this is Mr. Funderburk. If you would like to talk with him after the meeting and go over any specific cases, that would be fine. Thank you. Next is Nikki Melton.
My son is a middle schooler, and when he goes to the school, I opted him out from wearing a mask. Opted all three of my kids out from wearing a mask. But he don't want to be the only one that does not have a mask on. So he goes to school. I say, they're giving you a mask. He said, no, I got to keep this mask. I'm like, no, they got to give you a mask. Every 2 hours, they got to change his mask out. He said, they don't. They tell me I got to keep this one. I'm like, no, you don't. You can get a different one. They won't give me a different one. I said, they got to. I was at the board meeting. They got to give you a different mask every 2 hours. He said, they don't do it. They won't give me one. They told me I had to keep this one. I said, that's a lie, Alex. When you go in there, get you a mask. Don't keep wearing the same mask over and over again. But he does. And then I have a daughter that I spoke to you about that has NF. And she's taking medicine that is making her stomach hurt. And I told the teacher that when her stomach's hurting to let me know so I could bring her medicine. She don't do that. She tells her to wait till lunchtime to eat. She's on weight gaining medicine to make her gain weight. And they just say, wait till lunchtime. So she's sitting in pain, hurting during the day because they won't call me to come give her her medicine to make her stomach quit hurting. Why? I do not know. But I've discussed this with the school counselor, with the teacher, with everything. When she had her MRI done, I texted the teacher, told the teacher she had an MRI done. She just got put to sleep. If anything happens, if she's off balance, let me know. No, I didn't get no response back. I didn't get nothing back. Whenever I told the school that she's on this medication and everything, she responded back to me. But any other message that I send this teacher, if I don't go through the school first, I don't get no recognition, no text back, no nothing. And she has my child in her care with my child hurting. They pulled my child out of my hands, told me that if I walk her to the class, then she's got to let all the students walk their children to the class. All the parents can. Well, she tells me, Mama, why does this little girl with Mama get to come and hug her and make her okay whenever you can't hug me? I said, I don't know. She said, because her mama's a teacher and she gets to come in there and hug her and make her feel better. But why can't you make me feel better? I said, I don't know. She said, why is she better than me? I said, she's not better than you, Autumn. She said, well, why does her mama get to hug her and you don't get to hug me? I said, I can't answer that question for you, Autumn. So they pull her away from me every day while this other kid's mom gets to come in there and hug her child.
All right, thank you. Jeanette Champion.
Good afternoon. Thank you for allowing me to speak this afternoon. I am a mother, grandmother, and a great-grandmother. I've had children in Cleveland County Schools for years. I want to read to you tonight a paper. The name of it is Death by Mask, and it's Lessons Learned from Spanish Flu in 1918. In 2008, Dr. Anthony Fauci co-wrote a paper with 2 colleagues explaining that influenza was not the predominant case, it was not the predominant cause of death during the 1918 flu pandemic. There was a video also about it, but YouTube chose to take it down because they didn't want to hear the truth. Are doctors witnessing the early signs of the next round of deaths due to infections? If so, these deaths won't be from COVID-19, SARS, but from people acting on the advice given by Dr. Fauci. Remember, wearing masks is a CDC guideline. Guidelines can be ignored, especially when what is meant to protect you can lead to infections that will kill you. Why hasn't Dr. Fauci told us about the lethal risk associated with bacterial infections from wearing masks? I thought the Hippocratic Oath was to do no harm. Could mask-induced infections and deaths get labeled as SCARS, COVID-19, or God forbid, COVID-21, which will lead to more government lockdowns and trying to mandate the vaccines? You have a choice, and you can preserve your health and our children's health and future for the better. Please, wearing masks should be a choice and not a mandate. Thank you.
Thank you. Next, we have approval of the minutes, and there are 4 sections of minutes. Is there any opposition to taking all of those at once? Okay, so the first one is approval of minutes of the August 9th closed session, which are transfer hearings. Then we have approval of the minutes of the August 9th business and closed session. Then we have approval of the minutes of the August 9th closed session for the student and personnel issues, and then approval of the minutes of the August 18th emergency called session. What would the board like to do?
I move to approve.
Move to approve. Is there a second? Any questions on any of those minutes? I didn't hear the second. Who was this? Mr. Hunt. Okay, thank you. All right. All those.
I got a question. Is Mr. Fish on Zoom? We had not mentioned him.
He's off tonight.
Okay, all right. Just wanted to make sure that people knew that he is off or whatever, because he mentioned something about he might be on Zoom.
Okay. All right, all those in favor of the minutes as presented, if you'd raise your hand. That motion carries. And we'll go with committee reports. Finance and Personnel is Mr. Shores.
Yes, Mr. Chairman. Finance Personnel Committee met on August the 27th at 10:30. Dr. Fisher presented the proposed contract with the Cleveland County Health Department to the committee. This memorandum of understanding outlines the collaboration between the Health Department and Cleveland County Schools and speaks specifically to the employment of school nurses. Dr. Fisher reminded the committee that the school nurses are employed by the Health Department and are contracted to work in our schools. as part of the MOU, or Memorandum of Understanding, as I'll call it MOU from now on, the schools pays 40% of the actual nurse costs for the prior year. The actual nurse costs for the 2021 was $1,286,948.39, in which Cleveland County Schools is invoiced for the amount of $514,779.36. Given the amount of the invoice, this will be need approved by the board tonight. The committee gave the MOU and invoice a favorable recommendation, and the MOU and the invoice is on the agenda after I finish speaking. Included in this board's new strategic plan is a goal for the district to update the classified salary schedule with the proposed legislation that includes raising the minimum wage for district employees to $13 an hour. The district is examining new salary schedules that will benefit all classified employees. Dr. Fisher commented that the district would be prepared with a recommendation as soon as the state budget is passed. The committee hopes to have a state budget soon and then take action on a new salary schedule this fall. Mr. Kopinski updated the committee on the status of the state budget. As of now, it's a waiting game to see when the budget passes. The governor, House, and the Senate have released their versions of the budget, and it sits with the budget conferences at this time. Mr. Kopinski then informed the committee that the school's external audit for fiscal year 2021 is in process and is going well. To this point, no exceptions have been noted by the external audit from Anderson Smith White PLLC CPAs. Ms. Wampler provided a brief personnel update with no new business. The meeting was adjourned. The next meeting was scheduled Friday, September 24th. I do want to say this, as far as the personnel update, is if anyone's listening, and Cleveland County Schools is in dire need of bus drivers. If you know of anyone that would like to drive a bus, please apply. We have teachers, we have assistant principals, we have staff from all over driving school buses, and I think we may even have one or two doing double routes. So we're getting in a jam, folks, and it's with bus drivers. And I just want to say that if anybody knows anybody that would like to drive a bus, we are taking applications. Thank you.
Thank you. So we have one action item from committee. That is the Health Department contract. Again, that is for 40% of last year's cost. So that contract total is $514,779.36. Just to note, this is down from over $600,000 last year. So that's coming from committee, so it needs no second. Are there any questions or discussion? Yes, sir, Mr.
Is that our original contract, or is this strictly the COVID? In other words, we usually have original contract every year.
Yes. The contract's still there. It's 30-something pages.
Right, okay. This is part of that?
Yeah, this is our standard
Okay, all
Health
right.
Department contract.
I just wanted to make sure that we wasn't coming in with another
No,
a little bit later.
no.
All right, okay.
Any other questions or discussion? All right, those in favor of the Health Department contract, if you'd raise your hand. And that motion carries 8-0. Next, we have our standard personnel report. This has not been through committee, so what's the pleasure of the board?
Motion to approve the personnel report.
Second.
Motion by Mr. Hunt, second by Mr. Glover.
I'm going to recuse myself.
Yeah, I thought so. Ms. Green is recusing herself. All right, we have a motion and a second. Any questions? All right, those in favor of the personnel report as presented, if you'd raise your hand. And that motion carries 7-0.
I do have one question on it, that we need to make sure that we are posting our jobs so that people do know that the jobs that we have out here opening, that all jobs, so not just bus drivers, teachers assistants, food and nutrition, that we make sure that we're posting these jobs.
Yeah, they're all on the website. If folks, you can go and look for career at Cleveland County Schools on our website.
Okay.
Next is educational programs. Mr. Humphries.
All right, thank you. So the Educational Program Committee met on August the 27th at 10:30 a.m. Tamara Goforth presented information on the district's PALS program, which is Parents or Partners Aligned for Literacy Success. Posters are being created for our K-12 classrooms to promote reading, and there's some other aspects of that will be rolled out. Ms. Pillar shared the minutes from the Policy Council meeting and the annual report to the public, both of which require approval. The committee approved the pre-K information and referred to the September full board meeting today. Due to COVID, we did not fill all slots last year. Enrollment is not at capacity this year. North Carolina pre-K gives us until November, and Head Start gives us until January the 1st to meet capacity. We currently do not have enough families at the appropriate income levels to fill all the spots. Due to income requirements, some students are on a waiting list. Head Start information for approval is on tonight's agenda. Mr. Weiss shared the standard technology bid information and explained each product on the list of bids. He also explained how the bids were advertised and accepted. Mr. Weiss evaluated the proposals based on a rubric that he shared with us. Our schools can use these yearly pricing quotes up until June the 30th, 2022. Mr. Weiss also presented the contract for Trafera as part of the ECF Emergency Connectivity Fund for 14-inch Chromebooks, which will be distributed to our teacher assistants. This device is on our competitive bid TIPS contract. Mr. Weiss presented quotes for 600 Kajit and 400 T-Mobile devices, which are hotspots, with unlimited service for distribution to our schools for disbursement to families that need internet connectivity. These would be especially helpful for students who might be homebound due to COVID. We need 2 providers because of the tower locations in the county. We have spots in the county that one provider just don't cover. We have to follow all the guidelines for student connectivity. Both quotes exceed $75,000 and therefore require board approval. The committee recommends all 3 of Mr. Weiss's proposals to the board for approval. Dr. Fisher presented the MOU with Cleveland Community College to the committee for their review and approval. The MOU will need full board approval. The Career and College Promise CCP program is an excellent program for our students. Cleveland Community College is requesting compensation in the draft MOU that we pay $50 per course. Cleveland Community College would invoice Cleveland County Schools twice per year. This amount should not exceed $150,000. The committee approved the MOU and recommends it to the board for approval. And meeting was adjourned. Our next Educational Programs Committee is scheduled for September the 24th at 10:30.
Thank you. So we have several action items coming out of the Educational Programs Committee. First is the Head Start Annual Report, and the committee recommends approval. Are there any questions or comments about the Head Start Annual Report? All those in favor of approving the Head Start Annual Report, if you'd raise your hand. And that carries 8-0. The next item we have is the Cleveland Community College MOU. I'm also on the board at the community college, so I'm going to recuse myself from this discussion, and I've asked Mr. Shores as vice chair to take over this part.
Okay, thank you, Mr. Chair. The MOU did come from committee with approval, so what's the pleasure of the board? It doesn't need a second. Don't need a second, that's correct. Doesn't need a second. So all in favor of the MOU with Cleveland Community College, please raise your hand. And that passes unanimous. Thank you.
Thank you. Next, we have the technology bid documents. This is basically creating a local approved vendor list that our school system can purchase from without having to do bids each and every time. That's coming from committee, recommended for approval. Any questions or comments on the technology bid documents? Those in favor, if you'd raise your hand. And that motion carries 8-0. The Trafera contract is next. This is providing Chromebooks for our TAs. That'll be 300 Chromebooks at $399 each plus tax. Grand total is $127,779.75. Again, this is coming from committee, recommended for approval. Any questions or comments? Those in favor of the Trafera contract, if you'd raise your hand. And that motion carries 8-0. Then we have the hotspot proposal contracts. There are two of those, and we'll take those together if there's no objection. First is with Khajiit. That is for $78,132.76. And the second is with T-Mobile for $77,568. Again, that's coming from committee for approval. Any questions or comments? All those in favor of the hotspot contract, if you'd raise your hand. And that carries 8-0. Next is Operations Committee. Mr. Blanton.
Yes. Operations Committee met Friday, August the 27th, at 9 o'clock. The meeting was called to order, and David Pless provided a brief transportation update as well as an overview of the 74 bypass project impact on the bus garage property. The offer to purchase will require board approval. The offer is expected in the next few weeks. Daniel Sherman then provided us an update on Burns and Crest High School gym projects. The projects are almost complete and have turned out very well. The schools are extremely pleased with the project. There was some discussion about the expansion joints in the floors, and Mr. Sherman provided information about the expansion spacing or washer rows from the manufacturer. Well, I was the one that questioned the expansion joints in the hardwood floors. I'm going to just go ahead and let everybody know. I've never seen a gym with hardwood floors with expansion joints in it every 36 inches, but they say this is a new way. John Yarber then provided us an update on the auditoriums. Included, Mr. Yarber updated was a summary information on the meeting with the school principals as well as his meeting with the architects on the timing of the project. Due to the scope of the project, the timing will be very important as much of the construction will be during the school year. Mr. Yarber emphasized the importance of getting the grading and the traffic work done during the summer months. We hope to have the bids documents ready for the auditoriums in late October. Jennifer Wantner and Chip Childers updated the committee on the progress of CMTA and the HVAC assessments. All the school assessments have been completed, and we have the reports from 3 of the 4 schools. The committee discussed the next step and decided to engage in the conversation with CMTA about the project design work. Ms. Wantner has a scheduled meeting with the CMTA coming soon. Ms. Wantner and Mr. Childers also went through the capital project report. This report is the first of this year. Stephen Fisher then highlighted the most recent conversation with McMillan, Prasdan, and Smith. MPS has completed their review of the elementary and the intermediate schools in the Shelby and Kings Mountain attendance zones. MPS will be at the committee meeting in September and is expected to have some updates and reports from their work so far. The assessment of the team has moved to the Burns and Crest zone to begin the assessment process of those schools. Dr. Fisher reported that the demographic work with the MPS should have some projects in September as well. With no new business, the meeting was adjourned, and the next operations committee meeting is scheduled for September the 24th and at 9 a.m. And I have something else to add, to make sure that we get the project for the central school and the house at Grover that, I've had several calls this week. They need to know how to contact if they want to put a bid in on those, the house and the central school.
Should just call you, right, Dr. Fisher? Okay.
Call you. That's what I told them.
Thank you, Mr. Blunt. Next, we have our policy committee, and that's Mr. Umpers.
So the Policy Committee met on Tuesday, August the 17th at noon. We began by reviewing Policy 2410, which is policy development. The committee compared the suggestions provided with the current policy. After discussing the differences, the committee decided to move forward with the revised version of Policy 2410. It will be in first read tonight. Mr. Swampler provided an update on several policies located in the old manual that either need to be retired or moved to the new manual. A summary of the updates and actions are to follow. Policy 4300 from the old manual is recommended for retirement. This policy has been replaced by Policy 6125 in the new manual. Policies 4300R, 4300R1, 4300R2 from the old manual recommended to move to the new manual as Policy 6125R1, 6125R2, 6125R3. Policy 3560R from the old manual is recommended to be moved to the new manual as Policy 3320R. Policy 5145R from the old manual is recommended to be moved to the new manual as Policy 7241R. Policy 7130 from the old manual is recommended to be moved to the new manual as Policy 8105. And Policy 4220, the Code of Conducts in the old manual is recommended to be moved to the new manual as Policy 4310 with updated policy numbers and recommendations from the attorney. We discussed all the policy recommendations and unanimously supported them. These policies appear as first reads at tonight's board meeting. And the next policy meeting is September the 21st at noon.
Thank you. We have 3 policies for approval. Those were on first read last month. So those 3 for approval are Policy 5121, which is disposal of confiscated weapons, drugs, and alcohol. Policy 7730, which is employee conflict of interest. And then Policy 7730R is an employee self-report of secondary employment, and that one is a form. That comes from committee, recommended for approval. Are there any questions or comments? If there's no objection, we'll take all 3 at once. All right, those in favor of Policy 5121, 7730, and 7730R, if you'd raise your hand. And that carries 8-0. Then we have policies for first read. We have Policy 6125, R1, R2, and R3. Policy 3320R, 7241R, 8105, Policy 4310, and 2410. All of those are up for first read and will be discussed at our next board meeting. Next, we have our Safety Committee. Mr. Glover.
Thank you, Mr. Chair. The meeting was called to order on August 25th, 2021 at 12 o'clock. Dr. Fisher presented the SRO contract with the town of Bowling Springs for the Bowling Springs Police Department. This is a 3-year contract renewal. Due to the amount of the contract, the board approval is needed. The committee supported the recommendations of the 3-year contract, and the contract is on tonight's agenda. Dr. Fisher provided a very brief update on the start of school and COVID-related information. School has gotten off to a great start, but the district continues to deal with multiple challenges related to COVID. Dr. Fisher updated the committee on some school safety upgrades, and Daniel Howell with the Cleveland County Sheriff's Office was able to add some additional information from the law enforcement outlook. David Pless and Ronnie Funderburk provided staff updates related to school safety. Mr. Funderburk updated the committee on some training that he had attended regarding safe school planning and coordination with law enforcement. The committee discussed the progress of adding cameras to our elementary and intermediate school safety protocols, and the district's technology team is in the process of ensuring safety cameras are installed for the additions made to the school safety plans, and additional cameras are coming soon. The committee also discussed the process of which parents opted out from having their children's name or picture used in any school media form. The district staff explained that process. A concern about field trips was discussed, and the district is closely reviewing all requests. Most all trips have been delayed or canceled. The meeting was adjourned, and our next meeting will be held September the 29th at 12 o'clock noon. And we do have that one recommendation with the renewal of the contract with the town of Bowling Springs.
Thank you. Okay, the contract with the town of Bowling Springs, this is for SRO services at Bowling Springs Elementary and Springmore Elementary. Again, that's a 3-year contract with a not-to-exceed cost of $204,000. That is coming from committee, needs no second. Any questions or comments? All right, all those in favor of the Bowling Springs SRO contract, if you raise your hand. And that motion carries 8-0. Next, we have student transfer request. Those are on your board docs. What's the pleasure of the board? Motion by Mr. Taylor, second by Mr. Blanton. All those in favor of the student transfer request, if you'd raise your hand. That motion carries 8-0. Dr. Fisher, it's your turn. Now, look, we got through all of that in 38 minutes, so.
That means I've got lots of time tonight.
Yeah, well, you're on the clock.
I've got, I appreciate you guys running through that quickly. That gives me lots of time tonight. By my clock, I've got until 8, so I got an hour and a half to talk. I've got a lot of information, so I can slow down and go through it slowly.
Remember who you work for.
I am just kidding. I do have lots of information, but I will try to go through this quickly. Mr. Chairman, if you're good, I'll be glad to entertain questions as we move along. If folks want to wait till the end, that's fine as well. Before I begin with the COVID update, I'd just like to publicly thank and commend the work of our staff and our partners at the Cleveland County Health Department in terms of what we're doing, what the school system and our teachers and our teacher assistants and our administrators and our maintenance folks and custodians and child nutrition, and I could go on and on with the phenomenal work that's happening in school. And I think sometimes, I know I forget that in addition to COVID, we're having school. And we're teaching students to read, we're teaching students to factor equations, we're doing science experiments, and we're doing all these things that we do on a normal school year that keeps our 2,000 plus staff members very busy. And we're adding then the challenges of COVID, whether there's positive tests, whether they're quarantines, contract or quarantine tracing, doing all those things in addition to continuing to have school as we normally would. So I just want to commend our team. I want to commend our entire staff from the district level to the school level to central services, our maintenance departments, transportation departments, child nutrition. Again, I don't want to belabor the point, but I do see the great work that's going on. And in my position, I do have the opportunity to visit schools, and I see where the magic happens every day. As a parent of 2 children that attend Cleveland County schools, I see the wonderful things that are happening in our classrooms across the district. So I'm very appreciative of our team and just wanted to publicly acknowledge them. So tonight I've got some COVID data, some COVID updates for you. Quickly go through that in terms of positive cases, in terms of close contact quarantine data, some practices and things that are going on, and some reminders. So again, I'll try to go through this as quick as possible, but if there are questions, feel free to stop me. I'm going to start with positive cases, and I tried to summarize this in as best a format as I can. You see two sections of this. The first section is prior to August 23rd. August 23rd is when we started with our traditional schools. The week of August 2nd in Graham Elementary, we had one positive case. The week of August 9th, we had Graham and the early college in session. We had 7 positive cases. The week of August 16th, again, was Graham and the early college with 4 positive cases. Obviously, beginning the week of August 23rd, we've had now 30 schools in session, 29 of which are face-to-face, one Cleveland Innovation being a remote-only school. So you can see a lot more students were attending school. The week of August 23rd, we went to 105 positive cases. The week of August 30th, we went to 198 positive cases. And the week of August 7th, which was last week, we had 162 positive cases. So that gives us 477 positive cases. This is students and staff. And let me try to clearly articulate, because if not, we can get confused about, well, you know, this data reports that you have 477 positive cases, but you can look at some other data I'll present to you, and if you start doing the math, you're like, well, that don't all add up. So which data is right? Well, they're both right. This is a count of students that were in school. So what we're not counting is students that were positive prior to school starting, whether they were positive because of an exposure of an outside group, whether it was positive because of a church group, whether it was positive because of even a school activity prior to school. These are students that were attending school at least one day and then were positive. So that's the caveat with that, with those positive cases. Ms. Wampler does a great job of keeping up with this data. She's very meticulous at going through that data. We see all those emails coming in. She doesn't let me touch the spreadsheets, and that really works well because you've got one person making sure that data is entered correctly. That week, she entered the data this morning that was from the weekend, and that closes the week of September 7th. And then we'll have data that continues to be added to. This data is reported on our website. It's reported on a daily, day by day. It's not broken down to weeks like we have here, but it's a daily count per school. So you can go in there and do that. Sometimes there is a time delay of reporting. When does that data get updated? So if as parents see that data, just like the data on the DHHS website or dashboard, that sometimes that takes a little bit of time for it to update. I will say that when you look at this data, the 477 positive cases, approximately 90% of those cases are student cases. Only about 10% are staff cases, which is different from last year. So we're seeing more student cases than we are school cases. Again, these are school cases that are in school once school started for those students. In your packet, you've got a little more detailed breakdown of some of that information. This data here is from the DHHS dashboard. I've given that website there. You can go look at this. This is county data, and this is data that's outside of Cleveland County schools. So you could have students included this data that are not enrolled in Cleveland County schools, maybe hadn't been to school yet, but I thought it was just relevant to look and see where COVID is in a breakdown. Again, this is not school data. This is county data from the DHHS website dashboard. The week of August 29th, which is the September 7th data, is not available yet. It was not available as of this morning about 9 a.m. There were 53 cases between students between the ages of 15 to 17, 88 cases between the ages of 10 and 14, and 56 cases between the ages of 5 and 9. So you can see that breakdown. Again, you have a breakdown of the week prior to. Again, that information is on the dashboard. This PowerPoint will be placed on Board Docs, so folks can go on that website as well. Again, this is county data. Again, this data was pulled off the DHHS dashboard this morning at 9 a.m. The current 14-day positivity rate in Cleveland County is 17.8%. There's been 1,294 new cases of COVID in the last 14 days and 608 cases in the last 7 days. Again, that is Cleveland County summary data. That's not just students. That's everybody. We have questions on quarantine, and if there's one word that I've used and heard a lot over the last couple weeks, it is quarantine. Working with our schools and our parents and community on quarantine. So obviously, you guys are aware, we have a student accountability, student information system called Power School. And when we deal with Power School, in Power School, there's attendance codes entered. And then there are attendance codes that are entered from, with quarantine data. So we can go in Power School and look and see if a student is present remotely, meaning they're out of school, they're remote that day, probably because of quarantine, but they're present, they're engaged in their lessons, or they are a straight quarantine entrance into Power School. So we pull this number from Power School, and I've sent you, as board members, I've sent you this information on a somewhat daily basis of how many students are entered as quarantine into Power School. And so that's ranged between, slightly under 1,000 students, which is approximately 7%, to a little over 1,250 students, which is a little over 9%. And again, this data is taken daily from Power School. Today, we were even under 1,000. We were a little over 900 today, which is a little less than 7%. And those are what we would code as 1Rs or 1Ds, meaning present, remote, or quarantine. We'll tell you that is taking out of, I took Cleveland Innovation out of that total. If you look at when I send those reports to you, you have two totals. Usually you have the one total that's about 210 students, larger than the other. Cleveland Innovation is full remote, so obviously they're full remote every day. So they really don't count in the quarantine data. And that's just one way for us to keep track of how many students are on quarantine based on what's entered into Power School. Again, and I'm going to reiterate this a couple times tonight, and sorry for the redundancy, but as an old teacher, I think that, when you're thinking about an instructional part, the things that are important, you say those things a couple times. And so students are quarantined from school when they are determined to be a close contact. And I've said before, close contacts are students that are people that were within 6 feet for more than 15 cumulative minutes in a 24-hour period. It is important to note that our close contacts come from inside and outside of school. So we have a good many students that are quarantined from school that have no exposure at school. They're quarantined because of an exposure at home, an exposure outside of school. They're still quarantined, and they're still on our quarantine numbers, and they're still in that bullet at the top. And you'll see those students again in another display I'll show you in just a minute. But they come from inside because of their close contact inside of school, but they're also close contact outside of school. This, again, jump right into that. So this is active cases. Our schools, each school has a COVID tracker, and it's set up by the school. It's managed by the school nurse, the school health tech, administrators. Ms. Wampler and I, we have access to look at those trackers, and sometimes when the school has things, we'll go in and look at their tracker and get some information. This information is pulled by the health department directly from the school's tracker. So any student that's symptomatic, contact, or positive, anything related to COVID in the student is entered into that tracker, so we can keep good information and good evidence of that. So, and I appreciate Heather Voles, the amount of time that she's spending working and pulling this data. So, and you see just a couple of dates we've been in school a little over, I think today's day 15. So we've pulled that 5 different days. August 27th, we had 125 positive cases, and those positive cases had 494 contacts. You can see how that's trended. On August 31st, 152 cases and 747 contacts. September 6th, 180 and 778. September 10th, 165 and 568. And now today, she pulled that late this afternoon after school today, and 159 cases and 535 contacts. Let me talk a little bit about, I'm just use September 13th as an example because it's the most relevant data. Those are active positives. You said, well, you said just a few minutes ago we had 477 positives. That's a cumulative total. But right now, active in our tracker, we are monitoring 159 active positive cases of COVID in our schools. That means that positive case is not cleared for some reason. You would have students that are involved in that could clear tomorrow because they're still in their 14-day period. You may have students that just went into that today. So that is a daily moving number that changes. But that's 100. That's why we don't pull it every day, because it is going through 29 school trackers to keep up with that. But 159 cases and 535 contacts. What is, and so when I first looked at the data, I called Heather back and I said, so that means that out of 159 cases, they've had 535 contacts, so that's roughly 3.5 and 4 contacts per case. And she said, well, no, not necessarily. Look,
Excuse me, teacher, I'm sorry, no disrespect. I was misinformed about the location. I have 2 twin girls that go to y'all schools. I have a 14-year-old son that go to y'all school.
Okay,
I would like to speak when he's done
well,
concerning my kids. That's all I have.
I'll be glad to talk with you after
Yes, sir.
our meeting, but we've got our agenda approved and we need to continue on, so.
Mr. Queen, it may be beneficial if he would like that Mr. Borders and Mr. Funderburk may be willing to speak to him now if you'd like to go speak to somebody.
Mr. Borders, if you'd like to go meet with them, that would be fine.
When I talked to Heather about the 159 cases and the 535 contacts, that does not mean that 159 cases created the 535 contacts. It would have created some of those contacts, but included in those 535 contacts are people that were contacts outside of school as well. So you may have, out of that 535, there are a portion of that are contacts from outside of school, not just in-school contacts. Again, that 535 contacts includes in and out-of-school contacts. It does not include students that are on the tracker for symptoms. So if a student is symptomatic and they may be quarantined because they're symptomatic, they are not included in that because they're not a contact for school, they're just symptomatic, and so we're still in the process of monitoring that. The one thing I like about this active case is it tells you some information at that time, but it also gives you some trend data over the course of time, and that's why I displayed it in this manner, to be able to say, okay, where are we at, what are we trending, how that's moving. Again, in your packet, you have a little more detailed information there. So we want to talk a few minutes about quarantines and get into a few things. And again, I know there's a lot of text on the screen. I hate to read a text on the screen, but I want to, for folks that are listening and for our audiences, to make sure that people, have a good handle on what is a quarantine and what those things are. I want to try to quickly go through this. What is a quarantine and how it's applied? The CDC continues to recommend a quarantine for 14 days after last exposure. As of December 2nd of last year, the CDC has offered options to reduce the duration of quarantine. And you've heard these. This is widely recited. You can reduce that to 10 days of quarantine have been completed and no symptoms have been reported daily at home monitoring. It's important, no symptoms. If you're quarantined for 10 days, you don't have symptoms, after that period of time, you can go back to school. 7 days of quarantine have been completed. No symptoms have been reported during daily home testing. And you've tested no earlier than day 5. So if you're quarantined and you test on day 2, that test does not count to reduce your quarantine. You need to test on or after day 5. It gives that potential virus an incubation period. So we've had some questions about, well, when is day 1? Day 1 is your exposure. So if you were exposed today at school, today is day 1, tomorrow is day 2, Wednesday's day 3, Thursday's 4. You can test on Friday, day 5. If you have a negative result, day 6, you're not symptomatic. Day 7, you're still not symptomatic, then you can return to school on day 8. If you don't test, you can 10 days of quarantine. If you become symptomatic, then that kicks you back into the 14 days for that exposure. Couple things.
Can I ask one question
Yes,
about
sir.
that while we're there? When you're saying after 7 days or 10 days, they're going to be tested, I've heard numerous people out in the community asking about testing, and they're getting different information. What test is appropriate? Some say that you can do a home test that's appropriate, or your rapid test. Some are saying that it's different things. What is the standard that the health department is telling us to do for the test?
We've had discussions with that, and the health department will accept at-home tests. We know testing is at a premium right now, but they will accept at-home tests. I'm going to get to testing, a little bit of information. We're trying to open up testing spots for our students and trying to be creative and innovative with testing, because we know that there is a backlog for testing now, but they do through the recommendations of the North Carolina Department of Health and Human Services, they do accept a rapid and at-home test. Mr. Glover, and there's some information on the parent sheets that will go home with students, whether they're symptomatic or they are a contact, and there's some information on our website that really explains that. I would encourage parents to really contact the school nurse or the health department with that. There is some conversation on there that a at-home test may not clear for the 90 days. If you get COVID, and then you're exposed within that 90-day time period, that a positive at-home test may not count for that. But again, that information's on that website, and I would really encourage people to really talk to their healthcare provider, or B, the school nurse, the health department. We get into that situation where we really want to answer, giving them medical advice. We would like for that to come from a medical professional, and we can really try to direct into that. Yes, sir.
And Dr. Fisher, just to add to that, the health department has updated their forms in the past week or week and a half, and there are flow charts for, if you're symptomatic or if you're a contact, or there's a third one, and it does go through in the flow chart and lists specifically what tests are accepted. So that has been updated, and all our school nurses are using that now. So that will help with that consistency.
We hope and we feel like that, and it seems just an observation that information has been helpful. It's on our website. If students are a contact or they become symptomatic, they should be sent home from the school with an information sheet from the school nurse or the health tech there. One thing before I leave this quarantine slide is one of the challenges that's created some frustration, and I understand that, is sometimes the delay in information getting to a parent, because depending on how the timing works, a student could almost be finished with their 7 or 10 days before they're notified. And the reason for that is, and just give you an example, a real example of something that may happen. A student goes to school on Monday. They eat lunch beside a student and it's not a problem. Tuesday, they don't really feel good, so they don't go to school. So Wednesday, they're really not feeling good, don't go to school. Parent tries to get them a test, can't get a test till Thursday. Take the test Thursday, the results come back Friday. So now we know Friday the student was positive, and we go back to quarantine trace, and we find out that there was a close contact on Monday. So now that's day one. You figure day 1, 2, 3, 4, 5. We knew Friday, and it's already day 5. And there's really nothing we can do about that, just because it takes time for that whole process. It's nobody's doing anything wrong, or really we can't speed that up. That's just a natural part of that. Sometimes, unfortunately, the test results may not come back till after hours on Friday, and the parent may know that their child is tested positive at 7 or 8 o'clock on Friday night, yet the school's closed. And our school nurses and our school teams and our teachers and administrators, they're working over the weekend trying to update that. But the parent may not update the school till Monday morning, just assuming nobody's at school. And then if the school's not updated till Monday morning with that, you're looking at day 5 was Friday, 6 and 7 are the weekend, Friday's day 8. So if that student is now as a contact from last Monday, they find out this Monday, they're already at day 8 in their quarantine, so they have to go home and quarantine for 2 more days, which, it's just working through that process. I think that's been a frustration. And again, we've tried to expedite that as much as we humanly can. There's just some of those things you can't speed up. Our notion is and I'm a big processes person, but if you stick to the process, then hopefully at the end of the day you become it works out at the end. And so I think we're trying to stick to the process, even though it may be frustrating, because you may be you feel like, gosh, I'm 2/3 of the way through the process before I got it. We got to stick to the process. I get it. There could have been other exposures in between there, and really to pinpoint that is challenging. But if we stick to that process over time, we think we know those things will work in keeping our students and our staff as healthy and safe as possible. Again, a little bit of COVID update, and this is just some parent information. Again, this is on forms on the website. And if folks have questions, their school administrators, be glad to help. School nurses, health techs, they are swimming upstream or drinking out of a fire hydrant, right now, but we will try to answer those questions. They can always contact us at the Central Services as well. Be glad to try to answer those questions. So is there a way to shorten quarantine time? Yes. In some cases there are. Students that are fully vaccinated and do not have symptoms do not have to quarantine after a close contact. It is recommended, but not required, and I want to make sure that folks understand that, to get a test between 3 to 5 days after exposure and wearing a mask until you get the negative test results. But that's not required. If you have the vaccine, you don't have to quarantine. You do have to wear a mask during that 14-day period if you don't test, but you're not required to quarantine if you're vaccinated. Students who are not fully vaccinated after a close contact in a classroom or other school setting, if masks are being worn appropriately and consistently by both the person with COVID and the potentially exposed person, they don't have to quarantine. So if both parties are wearing a mask, the person who's a close contact does not have to quarantine. So 2 masks means no quarantine. Individuals who have tested positive for COVID-19 within the 3 months and recovered do not have symptoms, do not have to quarantine. And again, we want you to verify that with the school health team. They will have that documentation. And then the antibodies, if you think you have tested positive, you can get the antibody test, and that means you don't have to quarantine. Again, these are not guidelines that we've made up. These are guidelines that are strictly coming from North Carolina Department of Health and Human Services that are endorsed through the Cleveland County Health Department, and we're adhering to those guidelines. Again, we're in the education business, and we try to rely on the health experts to give us that information. Are at-home tests accepted? And Mr. Glover, this gets to your question. Yes, in most cases, if an individual has no symptoms, at-home tests are accepted, positive and negative. If an individual is symptomatic and the symptoms are listed, again, this was cut and paste from the actual form. So in that form, you see symptoms above. Negative at-home test results require a follow-up PCR test. So if you're symptomatic, but you get a negative at-home test, you still need a PCR test. And that makes sense because the sensitivity to the at-home test aren't as good.
Mr. Chairman,
Yes.
the students that have been restricted from coming back to school due to close contacts, are we capturing the data to see if any of those or how many of those turn up positive? Or
Yes, sir. We have, so I do have some information, not in this PowerPoint, but I do have some information that goes back and pulls all of our positives, even prior to school. And the positives that we've got in that report even include church camps, they include band camps, they include, soccer practice before school started. And so then we look at what impact does school have on that, and were those school related or not. I can share with you, Mr. Humphreys, that a little less than 15% seem to have a connection to school. So the vast majority of positives are trending to where that's outside of school. But we are monitoring that. Again, we've only been in school 15 days with the incubation period of really 5 days. We're at, and I've said before, it really takes 14 days to get a full cycle. So we're just now getting to the beginning of cycle 2. I think by October we'll have some really good data on that, but we are monitoring that, and when we look at that, again, and a challenge with making strong assumptions with that is that students are exposed or potentially exposed in lots of different areas. They just don't, they're not at school 24/7. So when they leave school, we may think they've been exposed, but we also don't know other things, so those are challenges that we have. And so when we look at that data, we try to make generalized assumptions about that or generalized predictions about that, not to be able to say, it is definite, absolute, because we don't have control of everything.
and one other
Does that make sense?
Yeah, it does. One other thing that you might want to address, we've got a lot of requests for lots of detailed information. And I know that we've discussed that with council, and council has checked with other school systems and all. So my understanding is that we have to be very careful about the data we release to the public. Is that?
I think that's always it's something that we got to pay attention to, both what kind of data we are releasing and making sure that it doesn't violate any confidentiality clauses, but at the same time, it is, good, accurate data that we've got. And every piece of data, has a context, and making sure we're framing the context for that data to be able to to communicate the information we want to communicate.
So, yeah, I guess the point I'm making is, we're not withholding information. We're trying to make sure, it's a fine line, and we're trying to do what we can, but we'll also make sure we are not doing what we can't do legally. So,
That's correct. And that's one of the reasons why tonight is really a good time to present some of this data, because we've had 14 days in the school. We've been able to run some cycle and be able to see, okay, here's some things that we're seeing in terms of whether it's positive COVID trends, whether it's quarantine data, whether it's close contacts, all that information.
Mr. Short.
Yes, I'm gonna take you back a couple slides, and I'm gonna try to wrap my head around this.
Can't go backwards, Mr. Short.
Okay,
Sorry.
well, I'll read it out.
I'll let you.
September the 6th, you had 180 cases and 778 contacts. For the sake of this question, I'm just going to use this number. Let's say of those 778 contacts, 300 of them happened on September the 6th. Okay, so they go into let's just say a 10-day period. So let's jump to September the 13th, 535 contacts. Are those 300 in those 535?
Yet, they could be. That is active cases that we're dealing with right now.
Right.
So that we have students that could be included in September 6th, and we have students that are included in, could be included
If
in
that was day one of 300, I'm just using that number, just pulling it out of the air. If that was day one of 300 of them, then that 300 would be September 13th as part of that 538. I'm not saying that's what the numbers are. I'm just trying to get my head wrapped around it.
They could be. And so a logical question you could deduct for that, and I'm going to preface the answer before I even ask the question is, we don't have all the data on this, but a logical question would come, well, how did you move from 778 on September 6th down to 568 on September 10th? That's only really 4 days. How did you do that? One potential conclusion of that was, okay, after the first week of school, we saw several sports teams quarantined. We had lots of larger groups quarantined, that those quarantine periods ended, and so there's some time that's transpired there. So yes, a lot of that 568 would probably be included in that 535.
Okay, thank you.
Yes, sir. I hope I explained that adequately.
I just wanted to get my head around it a little bit
Okay.
better.
Well, someone could be a contact for more than one person. I mean, if these two are positive, then I could count as a contact for both of them.
In
actually
looking
be
at our
double
data
count.
when it comes in, Mr. Queen, we have lots of students we have a student positive at, elementary school A, and there are no close contacts. Well, that tells me, okay, they've been able to, and we'll get to lunch in just a minute, they've been able to distance at lunch, and so they don't have contacts. We'll have, elementary B, we've got 2 positives. One has 1 contact, lunch. One has 2 contacts, lunch. At the elementary intermediate, that's pretty much what we're seeing. The close contacts are coming because of lunch. Our school staffs have worked. We've talked, we're meeting again with principals tomorrow. Our principals are really doing a good job of trying to be as creative as possible with lunch to try to distance students so they're not considered a close contact. At our high schools, you have typically a little more at high school, because if you have an unmasked student at high school, at the elementary, they're really doing a good job of you and Mr. Humphrey sitting beside each other pretty much all day. And so if Mr. Humphreys is a contact to you, then he's a contact to you, that. And not that way you don't have 10 contacts, you've got 1. And that's a kind of a theory known as podding, where you have that. It's used a lot in our elementary schools. But in high schools where you're switching classes, if you have an unmasked student, then you have the recipe for multiple close contacts. And then if you get into extracurricular activities, that's when you could theoretically have lots more contacts because of a positive, because of some of the extracurricular activities. Areas of emphasis with COVID, lunch, we continue to distance as much as possible. With heat, it's hard to, with the heat we've battled in the first couple of weeks, hard to go outside and eat. Schools aren't set up with tremendous amount of outdoor dining areas, so we've used a combination of classrooms, cafeterias. I've been through elementary schools where they've got lunch sessions going on everywhere with with that, trying to distance as much as possible. And I really appreciate the work of our teachers and our administrators and assistants and everybody at the elementary doing lunch duty. We still primarily at the elementary schools are doing, lunch delivery. We do have in some cases, students walking to a centralized point to getting lunch, but we're trying to make sure we mitigate as many of the contact strategies as possible. Outside of school contacts is still an area of emphasis. We still have a lot of that. Dealing with that because anything that happens outside of school comes in and it impacts us. And the opposite is true. Things, anytime that happens inside school goes out and impacts outside too. But just a couple reminders, when should my child stay at home? When they have one or more of the listed symptoms, and again, that's on the information sheet, and those have been widely published for the better part of the 18 months we've dealt with the pandemic. The child or another household member is positive for COVID. The child has been identified as close contact to someone with COVID for the past 14 days, and if the child is being tested and awaiting results, we need that child to stay home. We still see some, not as many, of somebody in the house being positive or somebody in the house being symptomatic and waiting a test, and a parent sends their child on to school, and if as much assistance as we can get from parents as possible. If there's a presumed positive case, keep your child at home for a day, wait, see if that comes out positive or negative to eliminate as many of those exposures as we can. Extracurricular activities, quarantine tracing still applies to all school activities. We did align based on conversations with our health department and recommendations that they've got, and given our quarantine data from our athletics is aligned with the school quarantine. So now when you're coming off quarantine, as long as you meet all other North Carolina High School Athletic Association eligibility requirements, when you come off quarantine, you're eligible back to school, you're eligible to participate in extracurricular activities. That is a change we've made during the time. Proper mask wearing, again, we've tried to make sure that we've reinforced that. Yes, sir.
I had a question back up on the areas and stuff. I had a couple of calls today that we need to emphasize where car riders is getting picked up. At the gathering there was very much the kids was ganging up with each other, hugging each other, holding hands with each other, and everything else that maybe we need to emphasize that that was a whole lot of close contact is on the car riding lines and stuff like that. And so make sure that we are checking on that. And I want to add something to your mask. I'll just go ahead and then I can shut up. I hadn't talked too much tonight, so I need to get my 2 cents worth in.
You're going to go and mess it up.
I'm going to.
Okay.
I don't want to start nothing off new. We voted, Mr. Shores made a motion for us to carry masks to the schools, and we give them out to the classrooms. Well, I know some teachers that they got these masks and they didn't know what to do with them. 2 boxes, 3 boxes of masks that got passed out to them. They had no idea what to do with them. They're still sitting on their desk. They didn't know what to do with them. I said, you're supposed to be passing them out. We made a motion in our board meeting that if a child wanted to change its mask every 2 hours, they could change it. And I guess that was the reason the mask was carried around. Well, them teachers didn't know that that's what they're supposed to do with them masks. So we need to make sure that we have let the people know when we make a motion in here and approve something that we follow it and get along with it. It didn't happen. In other words, I think you call that poor communication. And I'm pretty bad about that. I don't communicate well. And
Mr. Blanton, if I can address that, and
but
again,
I do know that for sure, and I know it for a fact.
And if there's any communication issues between what to do with those masks, then we'll take responsibility for that. However, I think the conversation was that students be allowed to change the mask if they wanted to, and we're providing opportunities for them to mask. And so, if a child wants to change a mask, then by all means, we have provided students with masks, We will continue to provide students with masks, and if they want to change their mask, then we should not be, and I've not heard of examples, and maybe it is, but I have not heard of examples where we're denying a student prior to tonight, denying a student the opportunity to change their mask.
Yeah.
And so we'll communicate that to make sure from our school-based leaders and our school administrators that if a student asks to change their mask, that yes, give them a new mask. I mean, we're not we're not collecting masks.
That we will do that. We need to let that classroom know, those children know that we are offering that. If you'd like to change your mask, you're welcome to do it. Because now we had a lady to speak right here tonight, as you said just then, that her child asked and the teacher wouldn't let them have it. Now, I don't know who that teacher was. I have no idea. But that child asked. And if we put the mask out there, because Mr. Chairman Queen, he made it for sure that we have plenty of masks.
I have not heard a concern about that, but we will address that and make sure our folks
Well,
are
I had
understanding.
quite a few calls on that at a couple schools.
I would encourage folks, if they have that issue, contact me directly. I'll be glad to address that situation directly. But again, to my knowledge, we've not had that concern, but we will, make sure that the message is crystal clear, that folks have the opportunity, if they choose, to change their mask every 2 hours. Again, I think that should not be a problem and won't be a problem.
Okay. Well, if we can send out a notice to our principals and to make sure that they let the staff know, hey, we've got the mask, let's try to keep the kids that want it. But now, if a kid don't want that mask and they've signed that exemption form, they shouldn't, no teacher, be telling that kid he has to put it on if they're going to come in their class. And I've heard that too.
Well, that will be articulated.
And Mr. Bland, that's part of the day-to-day operations and the superintendent and the principal.
Well, it wasn't getting done, and we're talking about COVID, so that's what I'm addressing.
That's fine, and I'm not pretending that Cleveland County Schools is perfect. And
I never said we was.
And we've batted 1,000 on this, but we're working through things as they come.
Okay,
and,
well, I told you that I'm trying to be pretty
Right.
decent, and I'm staying decent. I'm just going to facts.
That's fine.
All right.
But it's, I think asked and answered, so, I mean, we'll make sure, and I'm sure Dr. Fisher will make sure that
Okay, we've
everybody.
been going to school for 15 days. That should have been made sure, and we made a vote at our last meeting.
Well, I understand, but it came up tonight.
Okay, we
So
got it, and I
I'm-
made it clear.
And the facts are that we have articulated that, and we will look into the facts and make sure that the facts are what the facts are. And that will be clearly articulated.
All right, thank you.
Mr. Chairman, if I may,
No, ma'am?
It-
You go ahead.
maybe Mr. Smelt should talk with
We
Mr.
can do that
Funderburk after the
Yeah.
meeting, speak with Mr. Funderburk about the details of her case.
Right.
Thank you.
I think we were on proper mask wearing. Again, and reemphasize that no quarantine is required when both students are properly wearing a face covering. Again, that's indicated in the guidance from DHHS and from our health department. And we really encourage folks to wear those masks properly to avoid that. And this is alluded to a couple different times, and the consistency of communication. We have over 14,000 students, and when you look at it, preschool students, almost 15,000 young people that come in our contact every day. We have well over 2,000 employees. So when you look at the total operation of Cleveland County Schools, you have a lot of moving parts. And you've got a lot of people that are doing their normal job of educating students and teaching school, and also combating the challenges that are faced with COVID. But we have run into some issues with the consistency of communication in terms of what type of tests are allowed. When does day one start? All those type of things. But I think working through that with our health department and putting those forms online, we've been able to increase that, and it seems like that consistency of communication is improving, and I really appreciate the work of especially Heather Voles, leading our school nurses, has done a great job with helping that. I will, just a few things, skipped a page on my slide, that masks continue to be required on all Cleveland County Schools transportation. This includes yellow school buses and activity buses. Currently, just a state data, and I sent this to you on Friday, I think it's all but 3 LEAs now have a mask requirement for students and staff. We currently have a mask requirement that includes an exemption process for students and staff. And one of the questions we get is about exemption, numbers. Approximately 10% of our students and 9% of our staff have an exemption. Senate bill, from a mask requirement legislation perspective, Senate Bill 654 just recently passed the Senate and the House and was signed into law by the governor, requires boards of education to vote on their mask requirement each month. And this can be in a regular business meeting or a special call meeting, and that is required action. Again, that's when we get finished with the COVID update, the board can move in that direction as they so choose. A little bit about testing. There was, you probably read a little bit about, maybe a lot about opt-in opportunities we have for testing. Cleveland County Schools did opt in to a testing program for symptomatic or diagnostic testing, not screening testing, but really symptomatic, meaning if a student was a symptom, we had tests available if students wanted it or staff wanted it. But that whole process has fallen on, I think the complexity of that and the size of doing that across the state has pulled the emergency brake on that program. So it is a little frustrating dealing with that. And so I think that is on pause. As a part of that, though, there was additional funds supplied, and because of the contract that we have with Cleveland County Health Department, and because our nurses are actually employees of the health department, not employees of the school system, the funding for Cleveland County went to the health department because they're actually the ones that employ nurses. So with additional funds, the health department's been able to hire 4 LPNs, 4 CNAs, 2 RNs that work with testing, and 2 CNAs for that testing and scheduling. So hopefully through this process that will continue to ramp up, and we're glad they will be able to have some additional funds to hire that. That is not a part of our contract. That's not our money. That's really money that's gone to the health department, and Ms. Hanson and Ms. Bowles have worked through that. Cleveland County Schools is partnering with Atrium and our virtual care clinics to offer testing for our students. This is part of our telemedicine project. This is brand new and was sent to our school nurses late over the weekend. This is a new program Atrium is hosting here. It will be actually, if you look out these doors right there, there's a set of doors on the parking lot. Students will be able to go in there and get tested from 3 to 5. There are 15 slots, and this is for asymptomatic contacts that are day 5 quarantine. So if you remember a couple slides ago, I said you can reduce your quarantine to 8 days or a 7-day quarantine if you test on day 5. A lot of students are having a hard time finding tests. So through the telemedicine project, we'll have this set up from 3 to 5. School nurses are working to register students in those appointment slots. People will need an appointment. If you I need a test that day. My student's out on quarantine. That fits in the time schedule. Contact your child's school nurse. She can help you get registered for that. Hopefully those things will go well. If that goes well, that's a good process. We intend to have that more often than once a week. We'd like to do it probably 3 times a week and maybe expand the hours. But those are options. It will be a virtual visit just like in schools and build through that same way that we do with telemedicine. Parental consent is required with that, and parents will have to, if they're not already a part of the telemedicine consent program, have to do that. Just a few general updates for COVID. We continue to limit visitors to reduce the risk of outside exposures. Again, we're continuing to work on spacing students at lunch to avoid quarantines. We continue to need parental assistance, and please don't send students that are symptomatic or awaiting test results. Information has been posted on our website, including parent information form and flowcharts for quarantines. Hopefully those flowcharts really make sense to folks. Proper mask wearing, continued emphasis on school practices, including cleaning of high-touch and high-traffic areas, limited gathering of students. Mr. Blanton, you mentioned that, and distancing as feasible. And again, we emphasize that passengers and drivers of school transportation must wear a face covering or mask at all times. And just a few slides additional, then I'll stop. Cleveland Innovation is a full remote school option for full remote learning. We get a couple questions about needing a full remote option, that is Cleveland Innovation. If folks will contact our office, we can direct them to Dr. Anita Ware, who is over that program. The application part of that was throughout the summer, and then when we closed school, the application is not online, but we do understand that may needs to continue to be a need for folks. So if they have interest in Cleveland Innovation, they need to contact the school. Other than Cleveland Innovation, full in-person instruction is the only option for our traditional 29 schools based on legislation that has been passed and governor's orders. We don't have the authority to move to Plan B or Plan C. If you remember last year, we spent all but about 6 to 9 weeks in Plan B, which was the cohort days, and the board does not have that option currently, as the state guidelines or state statutes dictate that unless you're a full remote school, which Cleveland Innovation is, that you are full in person. You can do short-term closures. We've had, unfortunately, to do that because of the number of contacts at a school. Short-term closures are able to be done. Teacher, staff, and other adults should perform self-monitoring symptoms and do not report to work if sick. And again, I emphasize a little more information about contact tracing there. So at this time, Mr. Chair, I will pause, try to answer any questions that board members have, and just remind you of conversations about Senate Bill 654.
Mr. Black?
Yes, I think you know this person I've been talking to, and I guess you might know this answer. I'm understanding there are a device that we could put on our air conditioning units. I've done a little checking around, and matter of fact, I talked to a company that we could add a device to our units, and it would basically kill the COVID in the air in our classrooms, and the mold, and the flus, all germs. This device would work, and that we could apply for some money that would be able to apply. Did we know that we could apply for money for attachment to go on our units like that? Did we know that? I've just learned that, and I think I had that person to talk to you and about that. Did he mention this device to you, the company?
I'm not familiar with what you're talking
okay,
about.
well, there's a device out here that we could put on our units.
I know there's a lot of companies selling a lot of stuff that would do that.
Charlotte Mecklenburg is putting it on their units right now, and that.
Can you bring that information to the next operations
Yeah,
committee?
sure can.
And
Yeah, that would be.
we can go over that in detail
yes,
then.
because it's really inexpensive if it does what it says it's going to do. If it's going to kill the COVID germs in our schools and the flus and the mold, it'd be money well spent. And if Mr. Finance man, and he can get the money.
All right, we'll definitely discuss that in the next operation.
All right, good enough.
Any other questions for Dr. Fisher on COVID matters?
Mr. Chairman, I do. Dr. Fisher, if you don't mind, would you elaborate on the comment that Mr. Humphreys made about consulting with council regarding posting data on the school website? Not all of us board members were made aware of that council decision.
Yeah, I think that really the gist of that, Mr. Taylor, was that, as you get questions about posting data, and everybody, I like to look at data, like to I check the DHHS dashboard every day, look at our data, look at that data daily. I think the conversation surrounded making sure any data we published was put out was not violating anybody's their HIPAA or FERPA violations, and making sure we're being transparent with that data, but also we're not providing information we shouldn't be providing. And so I think there's been some questions of that across the state of what data are you responsible to produce, what data should you produce, and what data should you avoid, because if you have a small school, you could potentially identify a student, and so that's one of the things we don't want to make sure we don't put out personal identifying information. So I think that that was the gist of that conversation.
Anyone else?
So you're saying that we cannot put how many students have been quarantined countywide in our school system at one time?
No, I'm not saying that. I'm saying that the conversation was, before we put data out, we need to make sure that it is data that we can put out. Not, we didn't, we're not saying we shouldn't put data out and we can't put data out. Obviously, I provided that data tonight. All I'm saying is, anytime we put data out, whether it's COVID data, whether it's instructional data, whether it's any kind of data, we have to make sure that that data is appropriate to be put online.
There was a request that came in, I think it was earlier today, that was asking for some very specific school-by-school data, and as he said, depending on the population of that school and how many positives you got, you could narrow that down to a specific person, and that's what we're trying to be careful of. So aggregate county data, I'm not going to speak for our attorney, but shouldn't be a problem, but it's when you get into more specific, the more you break it down, the more chance you have of.
And I understand that, but I think I've had a lot of conversation with people. They would love to see the numbers of the quarantine, and I mean, if we just do it district-wide, I think that would maybe give the information that the community needs. And I understand that if we break it down to a small school, I mean, that there could be an issue that when you have a whole classroom not present, that's going to narrow it down pretty quick.
And I think, Mr. Glover, I think too, and I understand the need to put data out, but also understand that we have to get into school and let the data get to a situation, because the first week or two of quarantines, a lot of that wasn't because of school quarantines. And so we're publishing school quarantine data that really is not school quarantine data. It's data that may be because of outside exposure. So now we're at a point where we really, and again, tonight felt good about what, putting the data out and to be able to say, is this data that we feel, we want to be able to produce and publish? Because I do think that it tells a narrative. We need to make sure we frame that data in the right way, that people understand what we're putting out.
And just to remind everyone, according to Senate Bill 654, each Board of Education is required to take action on mask wearing. I think it's every 30 days or exactly once a month, however it's worded. So we are required by law to do that tonight. As we stand, we have a mask requirement with exemptions available. So a motion to maintain status quo would be in order, or we can entertain a motion to do something different.
I'll make a motion that we leave it as we got it, people's choice, with the exemption form.
Okay, so your motion is to leave it like it is?
Yes.
Okay. Is there a second?
Second.
Motion by Mr. Blanton and second by Mr. Shores to maintain our current policy. Any questions or discussion?
The only thing that I would like to say, that I understand the exemptions, and I understand some parents like that. Looking at the information that Dr. Fisher has provided us, and it has it several times in here, wearing a mask knocks down the number of quarantines or close contacts in our school system. Our job is to try to have good attendance in our school system, have that face-to-face, and I think it is very important, and it had in here, that if you have two students, one positive and they both have a mask on, it is going to show that you don't have to quarantine that one student that's not positive, does not have to quarantine because of a close contact. I feel like that it would be good that before they have the exemption, that the students have a note from their doctor stating that they should be exempt because of a medical issue. And I'll tell you a couple of reasons why. It's no different than students having PE class, and they had to have a doctor's note to not participate in PE because they have an issue with their leg or their ankle or anything else. I don't think there's any difference with that. I've heard a number of people that students can just easily get on the internet, on our website, and they can fill this information out themselves without the parent even knowing about it. And that's troubling. That's troubling. But I also know that a lot of students are wearing masks even though their parents filled out the form, just because they want to wear a mask. They feel like they're doing the right thing. So I think it needs to be required, but I also feel like that the exemption needs to have doctor approval.
So
Let me-
hold. Are you making that in the form of a motion or amendment?
No, I'm just telling you.
Just making a comment?
Just making a comment.
Okay, I just wanted to be sure. Mr. Shores.
I understand where you're coming from, but when we voted last time, I got a text from a parent that son has asthma, can't wear a mask. She said, "Thank you very much. My asthma doctor is 3 months behind unless it's an emergency." Let's just say, for instance, we have 5% of the population of our school, just 5%, 700 or 800 students that have a real legitimate medical issue. When they're going to get, my point is, when are they going to be able to get the doctor's note? If asthma doctors are backed up 3 to 5, 4, she even said some people may be going after the first of the year to get a note. And we throw 700 kids into the medical field right now to get an appointment for a note. The numbers ain't going to add up. And are we going to have kids that have a legitimate medical reason not to wear a mask, sitting in class suffering because they can't get a doctor's appointment because it's not considered an emergency? Now, that I hadn't thought about that till that parent texted me and said I couldn't get a note until probably mid-October. And the other thing is money. Not everybody can afford to take their kid to the doctor. Who's going to pay for this? The third thing is, I know someone personally, I think we've had someone come and speak about their child's nose bleeding after they continually wore a mask. If I had a child, they're 9, 10 years old, however, never had a problem. They wore a mask for 6 weeks last year of school. Their nose started bleeding. During the summer, it quit bleeding. Then they put a mask back on. Their nose bleed. I don't need a doctor to tell me that the mask is a problem. So we are not trusting parents when we say we're mandating you to go get a medical note, much less if this took effect, how many kids tomorrow, I said 5%, let's just go lowball here. 5% of our student population probably have a legitimate reason not to wear a mask. That's 700, 800, I ain't done the math. We got 14,000 students, whatever that is. The medical field couldn't handle that. No way. So we're going to have kids sitting in a class that don't need to have a mask on for medical reasons. I understand where you're going, but it's just, I don't think it's feasible for the doctors to see all these kids and then the pay, who's going to pay for it, and then trusting the parents, and are we kicking out the religious exemption? And then what is proof of a religious exemption? The President of the United States the other day put a mask mandate on federal employees. Medical and religious were 2 exemptions. The governor of North Carolina shut down the state last year when this broke out. The motion that I read last time, I read verbatim. They shall not have to prove they have a medical reason. That was from our governor who shut the state down, and we're going and asking more than the governor did last year when he shut everybody down. I just can't see it. So I'm for staying as it is.
Mr. Chairman.
Dr. Fisher, you're welcome to sit down if you'd like instead. I hate for you to stand up in the middle of all this.
Well, he said he was gonna be an hour. And he done took iron.
It's an
45
hour,
minutes.
hour and 2 minutes right now, so we'll call you if we need you.
Mr. Chairman, if I may elaborate on Mr. Shores, we discussed, it's Executive Order 169, so I've checked and asked council to check behind me to make sure that the original exceptions and other explanations had not changed since this original. There's been various and sundry revisions of the executive orders and subsequent ones, but the exceptions, the only thing that's changed with the exceptions was the definition of strenuous exercising, I believe. Is that correct? So a minor change that has nothing to do with schools. So I won't go through the A through K exceptions. We've covered those the last time. But I would like to read what the governor's executive order said following the exceptions. He stated, anyone who declines to wear a face covering for these reasons should not be required to produce documentation or any proof of a condition. Children under 2 years of age should not wear a covering. He went on to say, and under the topic of application of exemptions, or exceptions, excuse me, he used the term exceptions. Under this executive order, all North Carolinians will be on the honor system about whether or not there is a reason why they cannot wear a face covering. Everyone in this state is asked to tell the truth, and if they are healthy and able to wear a mask, to wear a face covering, so that they do not put other people at risk of serious illness or death. So I'll join with Mr. Shores on that and say, look, the governor of North Carolina, who's got tons of legal resources at his hands, was not comfortable and is not comfortable requiring documentation for these things. Plus, I'm sure that they've looked at similar things to what Mr. Shore just mentioned. There's a lot of considerations in this, and it's easy to say, yeah, we'll mandate them and make them, but it's the old saying, fools rush in where angels fear to tread, so I'm perfectly content with it the way we've got it.
Mr. Hunt?
I think wearing a mask is important in keeping students in school. I don't know how many ways you can say that, to say that masks are important in controlling this virus. You talked about the governor's executive order. When that executive order came out, students weren't in school. They're in school now. Across the nation, we see kids that are getting sick from this virus. And we're charged with the duty of protecting students and staff. We've had a lot get sick here in Cleveland County, across North Carolina. We've got to put steps in place to control COVID, but yet we keep saying that it should not be mandated. And we're speaking for doctors when we're saying that they cannot see these kids because of a backlog. We don't know what kind of backlog they have. It's our responsibility to make sure kids are safe and to put guidelines in place in order to help assure that. Mandating masks right now should be a #1 priority because it's important in keeping kids in school. The contact tracing that's involved, if they're exposed to COVID, keeps them out of school less time. But we've got to be bold enough to say, we don't like it, but it's something that's necessary and it must be done.
Thank you. Ms. Green or Mr. Taylor?
Yes, I just want to say to what Mr. Shores was saying, I understand that the medical field is stressed right now and it may take time to get appointments, but we've heard from our local medical experts and professionals here, and I'm pretty sure they'd rather take the time to write you a note if you do need a mask exemption, rather than you going to school, getting COVID, and showing up at their doctor's office for a COVID visit. So they're going to be stressed either way. But this will, I think wearing a mask will help take the strain off the medical field here. And we all get emails daily that says, I don't know the solution, I don't know the solution. And none of us know the solution, but we do know how we can get our kids and keep our kids in school more. And that's by wearing a mask on mask, because the numbers show that most of our quarantines are coming from kids around non-mask kids. So if we want to keep our kids in school, we just simply say, you know, if everybody that can wear a mask, now there are some, and I believe in giving those that cannot the exemption, but the ones that can wear it, we just ask that they wear it so that we can keep more kids in school. I had a parent to tell me, I think her kid's only been in school a week, if that, because she was quarantined right when it started, went back for a few days and was a quarantine again. If that goes on all year, that, you know, kids can end up missing more school than they are in school. So we're just trying to figure out a way to keep our kids in school to get more face-to-face education. And if it's simply wearing a mask, if you can. If you can't, don't wear the mask. That's all, you know, it's just try to keep our kids in school, because we don't have an answer.
You all right?
I agree. I'm in favor that we at the very least, we keep what we have in place right now. I mean, I don't know how busy, well, we all know how busy the medical field is, but one thing that we don't know that's not that busy right now is the religious field. You know, I've yet to understand what religious belief prohibits somebody from wearing a mask. You know, I don't know that. I'm not, you know, if I was someone that was not, what's the word I want to put it? I'm not going to go that way. If you believe that your child does not need to wear a mask for medical purposes, then that's your choice. Religious belief, I don't agree with that, but that's not going to change here. So I say we continue with what we got. What we have is working. What we could do could work better, but what we have is working for now.
Mr. Blunt?
I will say, I think I understood Dr. Fisher to say that our numbers are trending down. And so I heard that. So if they're trending down with what we got, and I know one way they get rid of me. If I had to put two of them masks on, I'd suffocate to death before dark. And it don't like much being dark out there, because I can't breathe with them. I couldn't breathe when I used to paint cars. I didn't wear a mask because I couldn't breathe. Then the paint hardener liked to eat my lungs up. Okay, I started wearing it, and I could back near paint one whole side of a car without breathing. I learned to hold my breath because. So, like I say, wearing a double mask, there's no way. But I still believe in the people's choice. I don't have all this technology that Mr. Shores and Mr. Humphreys had. I've just got the old common redneck talk. And leave it to our choice. And parents, please, if your child is sick, keep it at home, and that will help more than anything. If your child is sick, keep it at home. Or if you've got a family member sick, and it could be, don't send your child to school. We've got the online innovation, and we'll go that route. And I hope I never hear what I heard this week, that a child was wanting to do his work, and a teacher told him, "Don't worry about it. I'm going to pass you anyway." That child was wanting to learn, be taught, and I hope I never hear that again. That really got to me, and but I'm for leaving it again. So I'm ready to vote.
We got a motion on the floor. Everyone's had a chance to speak. Kind of going once, going twice. Any further discussion? Yes, sir.
This plan keeps on saying, I believe it should be everybody's choice. Is that what the motion is? That we're-
No.
No,
No, it's just, the motion is to
leave it exactly the way we
leave the
got it.
policy as is. Yeah. Which, the policy as it stands is masks are required, exemptions are available with no documentation. Is the motion,
Can you clarify one thing for me?
I'll try.
Our original motion is during instructional time. Is that
Yes.
correct? So
It's masks are required indoors
indoors
during instructional time. That's 8 to 3, and that's for anybody in the building, whether it's a
So once the school bell rings at 3 o'clock and the kids, students are outside, they're outside of instructional time.
yes.
So to answer what you mentioned earlier, you've got parents who are concerned outside of instructional time. They're wanting something done for that. So my question is, are you in where you want mask optional in the classroom, but you want something done outside the classroom and outside the school?
Well, that our children needs to make sure that they're being safe too, even on the outside after 3 o'clock. That we bring that up. In other words,
So do we
because if
need
you're
to
gonna do
amend
it
this
on
and make
school
it?
grounds, then you're gonna have to do the sports too.
Well, that's right.
In
So what's
other words,
your favor?
What is my favor?
Yes, sir.
Well, I think if we're gonna require them to do it in the classroom, the sports ought to do it too, and boy, that'll change everything around then. Nobody wanna wear them, because they ain't gonna quit sports.
You gonna make it mandatory then?
No.
Oh, okay.
I'm just, all right. We got a motion on the floor to maintain our current policy, and it's been properly seconded. I hate to ask this, but I will one more time, dude. All right, I'm done. Seeing none, those in favor of the motion to maintain our current mask policy, if you raise your hand. That's 5. Any opposed? 3. Motion carries 5 to 3. Do you have further updates?
Oh, yes, sir. I still got the time left. Just real quickly.
We're starting to work on your evaluation now, if you get.
Just real quickly, I do want to applaud the resilience and efforts of Team CCS. I started that, and I want to end with that. I just appreciate the entire team, all 2,000-plus employees of what they do every day, and our partners at the Health Department, have a daily commitment to providing a safe and healthy environment for our students and staff. Our community, and I consider myself that as a parent, when I step out of my role as superintendent into my role as a parent, that our community is blessed with educators that care deeply for our students and their families. The one thing of announcement I would say is October 7th, we do have parent-teacher conferences. Parents will receive some information on that. We'll probably do some things differently this year because of the wide range of community spread for parent-teacher conferences. We will be working with more of remote and virtual phone conferences, just to make sure that our teachers are not exposed and we can continue to keep our teachers in the classrooms. But parents should be getting information soon about those parent-teacher conferences on October 7th. I think for many of our schools, progress reports are coming out soon. For some grade levels, they're coming out tomorrow, so just to encourage parents to be on the lookout for those. That's all.
Thank you. Board member comments. Mr. Hunt, do you have anything? You've had enough. Mr. Glover?
No, sir.
Mr. Humphries?
No, sir.
No. I done said it
Ms.
all.
Green? No? All right. Mr. Taylor? Well, I'm going to make it 100% on that one then. I'm not going to say anything. Well, I'll take that back. I will reiterate what Dr. Fisher said. We got 2 emails today from folks that are teachers and parents, and we hear your frustration. We know that you're having to do extra things because of all of this, as far as keeping seating charts and tracking where your kids are and preparing homework assignments for kids that are out of school. We see you, we hear you, and just like both of those emails mentioned, they didn't know what the answer was, and it's been mentioned up here tonight that we don't know 100% what the answer is, but we want you to know that we hear you, the teachers, staff, I mean, everyone in the school system's been affected by this, and everyone in the community, whether you work for the school system or you work wherever. COVID has not been kind to any of us. So I thank everyone for what they do. Mr. Shores, you have a motion to go into closed session.
Yes, sir. Pursuant, I make a motion to go into closed session in accordance with General Statute 143-318.11A3 to consult with our attorney regarding the McKinney versus Cleveland County Board of Education matter.
All right, have a motion, we have a second.
Second.
Second by Mr. Blanton. All those in favor of closed session, if you raise your hand. That carries 8-0. All right, we'll be back.